you very much for having me. Uh, of course, I'm not anybody from the academic field or the field of research or the field of, what should I say, the medical profession. So, whatever I'm sharing is more something personal. So, one of the things when we talked about my mother's not 98, she's 93, and
Okay.
I'm not 78, I'm 73. But what I'd like to say, because we have my mom, there's me, there's my daughter, and my grandson. So we are four generations living together in the UAE, which is not our home country because we're from India. But I think one of the most important things which I would like to say to everyone is that when we get old, most of us feel neglected. Most of us suffer from depression, loneliness, and sometimes we lose the will to live because we find it difficult to move around. And we also feel that we are not contributing, we are becoming a burden, so we have a lack of self worth. And all of these things are emotional, and then they have a negative effect on our health. So, to give you an example of my mom, she had a stroke during just before COVID, and she couldn't walk, she couldn't move, she was completely helpless. And there was my sister and myself trying to do things ourselves. We didn't know what to do. Eventually, we had to get some outside caregivers to come and look after her. And one thing I will say about my mom, from being totally helpless, she is absolutely mobile because she didn't give up. And we, as the family members, had a support system that said, you can do it. You are capable of walking again. So we brought her to my house. I have upstairs, downstairs. And till 3 months ago, she was climbing 26 steps up and 26 steps down by herself 3 times a day. Now, at 98, sorry, at 93, I think that's wonderful. And the reason for her to be like that is because there's a very strong emotional system in place. But that doesn't apply to everybody, and I know that. I live in Dubai. It is not my home country. I'm not entitled to any of the government sponsored programs for elderly, etc. So we have to make our own arrangements. So, what I would like to spend 2 minutes on is when we can have everything, the most important thing is money. If you can afford something, it's good. If you can afford food, if you can afford shelter, all of that is good. But if you don't have money, many things don't go well for you. And unfortunately, the older generations did not do financial planning. They depended on, especially the women, depended on their husbands. So if the husband did well, planned well, it was okay. But eventually, what would happen is the older person becomes a burden because he or she has to stay with a child who then has to adjust their lifestyle in order to accommodate and look after the older person. So, for both generations, it becomes a little challenging. So, what I would like to say, and my contribution to this event is very simple. Wherever you are, in whatever stage of life you are, please look at your finances, plan for the future, take proper insurance policies, take a good retirement plan, do your homework. Because the most important thing that we all, today, tomorrow, 10 years from now, have to beat is one word: inflation. So, what it costs today to look after yourself, to buy food, have shelter, go for medical checkups, etc., is just going to get more expensive. So, on the one hand, we can have a good support system, we can have a community system, but we still need money. And if we are do our research, if we plan correctly, we can all do it. Unfortunately, in Africa, just like in India, it's a very male dominated society. So the woman takes a secondary role even if she's working. Most decisions are taken by the man, and that is the social system. So it is up to us to educate the woman, educate the daughters to make sure that they are financially aware, financially savvy, and can make better use of whatever money they save or they earn. So my principle is the three S's. Whatever money you get from commissions, from salary, from business, whatever. First is you save, then you share as in community service, and then you spend. If you remember these three S's, save, share, spend, you will be able to have a good financial nest egg that can help look after you, pay your hospital bills, pay your physiotherapy bills, go and meet other people in the elderly community, stay in a nice retirement home, so that you're not a burden to your children and you can lead a nice, successful, happy, healthy life. That, I think, is what we all want. But it all comes down to one thing: money. So, at the end, I would like to say rethink what you're doing with your money, do your research, make sure that you take programs or investment plans or insurance plans after thorough research and see what works best for you. But most important, in your family, show love to your older people, respect them, value them for what they do for you, what they've done for you when you were younger and you needed their help. So open your heart, support them, and let them have a wonderful, fulfilling, loving life. Thank you. Can
It
I
is
just say
really.
one more thing? Can I say just
Please
one
go
more
ahead,
thing,
but
please?
please go ahead, please.
Okay, thank you. I started working when I was 46. Before that, I'd never worked in my life, so I couldn't write a CV and nobody would give me a job. But we were in financial stress, and I needed to help my husband on something to support us. So, from not knowing anything, I then spent the next 28 years building my career, building my financial services and everything. And after being for 28 years, I decided to resign from the company where I was a consultant. And when I wrote that on LinkedIn, everybody said to me, I hope you enjoy your retirement, because it is assumed that when you're a certain age, you're going to retire. And that is nonsense. So I started my own company, as it says in the article, at the age of 73. I'm ready to do many things. I'm full of energy. I'm creative. I don't care what other people say. I will do what I think is best for me. And I think that is what each one of us should do. Don't worry about what society says. Okay? Everybody's got their own opinion. But we need to be confident in who we are, no matter what our age. And most important is your health. So, my last sentence to you is fall in love with you.
Oh, wow. Fall in love with you. That is so beautiful. That is so beautiful, Queen. That is so beautiful. I'm going to start. I love myself and I'm going to continue to fall in love with myself. Thank you very much for that wonderful 1 minute that you really decide to share with us again. It is so insightful. Thank you very much. I'm not only going to be loving myself, good financial, good financial independence is the backing of a future, of a better future and a healthy future. Thank you very much, Queen. It is really wonderful having you here.